Hey, good morning, everybody, and welcome to Invisible Condition. It's not all in your head. I'm your host, Jeff Pearson, and we want everybody with an invisible condition to know beyond the shadow of a doubt that you do have a voice. You do have a community, and you are not alone. And I am so excited to introduce you to our guest today. Her name is Allison Beninato, and she is on a mission. And I love her mission. She's on a mission to create a multidimensional healthcare landscape, blending conventional medicine and alternative healthcare. Is it possible? I don't know. We'll find out. That's been something I've been passionate about. My wife has been really passionate about. I'm excited about this. This is going to be great. So Allison is the CEO and founder of 3 health-related businesses and is passionate about all forms of healthcare, not just the traditional, which I'm super excited about. So and she is seeking to bridge that gap between the medical providers and the alternative practitioners to, better support the overall well-being and care of all of us, of the individual. So let's welcome Allison to the show and get this ball rolling. Good morning, Allison. Thank you so much for being here.
Good morning. Thank you for having me.
This is awesome. I feel like over the last year that we've had this show so far, 1 year down and many more to come, hopefully. But I have noticed that more people that have been coming on the show have been talking about similar things what we're going to talk today. That the traditional model is not necessarily your only go-to anymore. There are so many more things that you can pursue to improve your health or to recover from something or from whatever. And so many more people are jumping on board with that. So I'm really excited that you are here, and I think the timing is perfect for it. So
yeah,
can you just kick us off and just tell us about Inspire Collaborative Health Association and what's the main goal? What's the vision of your association?
Yeah. So I think it's best to have people understand the background of how I got to this point. So I've been in Western medicine or conventional medicine for 23 years. About 10 years ago, I started getting into alternative medicine. I was having some health issues of my own, and I was getting no resolve to them pharmaceutically or from my medical providers. And so out of sheer desperation, I sought out an herbalist. And admittedly, I kind of went to him with a high level of skepticism and really low expectations because all I knew was Western medicine. And to my surprise, over the next 3 years, he was able to help me with 3 different health issues. And at that point then, in all of those health issues, my providers kind of had thrown their hands up and they're like, sorry, there's not much we can do. And he was able to help me with all 3 of them. And so at that point then, my clinical mind became very curious, like, okay, this is not anecdotal. This is not woo-woo. There is science and history and chemistry. And what is it? So I started going to school myself. I started getting certifications. I now am a certified clinical herbalist. I am a board certified naturopath. I have a few other ones. I don't need to list all of them, and so it just really sparked that curiosity. I also still work in the Western medicine field as I have a medical billing company. So yeah, as you mentioned, I have 3 different, so I'm very, very ingrained in both sides now. And after I started getting those certifications in the alternative or complementary side, I was still working with all of these medical providers, and they were starting to come to me and go, oh, you're an herbalist now. Can I refer people to you? Or do you know another trusted alternative practitioner? And then as I was meeting more and more alternative practitioners, they were saying, oh, you know doctors. Well, do you know open-minded doctors, ones that won't care if I go to an herbalist or an acupuncturist or a chiropractor or what have you? And so very quickly between the 2 sides, I became this hub point. And then there was family, friends, community members. Everybody was kind of figuring out that I was walking this very polarized fence of healthcare and coming to me and asking, who do you know? And it didn't take me long to realize, man, there is a massive demand here and nobody is supplying that demand. And so the afterthought to that wasn't too far behind that maybe I'm supposed to supply that demand. And so I started to conceptualize what that would look like. How do you simultaneously help 3 different demographics, the medical providers, the alternative practitioners, and the community all at once? And I did that with Inspire Collaborative Health Association.
Love it. That's awesome, because that's the missing, I think that's the missing link there, is how do you put them together? Because there's always been the alternative, the traditional, and the people, right? So it's that's really cool.
Yeah, everybody is very segregated, right? And in their own silos, kind of. So it's I created a new silo where everybody can come together. Yeah.
Everybody can play together and hopefully get along
in the sandbox. Yes, that's correct.
I'm sure. I'm sure. I mean, you've got a long way to go. Let's be honest. You know, there's a lot of.
I tell people, you know, I'm not here to. I've never worked sales a day in my life. My whole life, I've worked in medical clinics and in healthcare, and so I'm not here to sell anybody on anything. I'm not here to convert anybody. So this is really just about supplying a demand that was already organically in motion on its own. I just recognized it and I created a solution for it. So it is not my mission to go and try to, show this person or show that person or anything. It's just about creating options and education and just ease of use. And you know, I really believe that both health and sickness are multidimensional. And so that it's unrealistic to think that, you know, you could just have one provider help you with all these different facets of health. You can't say, I ate a salad today, so I'm healthy. Well, okay, what else are you eating? What are you drinking? How much are you moving? How are you sleeping? What's your stress? I mean, there's so many different areas that come into play to result in health or sickness, right? So you really do need to have that team of providers that understands that is willing to work together cohesively. And you get that with the association. We recruit those medical providers, those open-minded medical providers and those well-trained alternative practitioners to all come together to be able to work together. So now you can curate your own team for what you need personally in your health.
And those alternative, I mean, medical providers, they're probably on board. They're like, yeah, cool. But I have a feeling, correct me if I'm wrong, the alternative providers are the ones that you're like, okay, we have to play nice with the medical doctors. You know, we're not here to like try to take people away from them. We're working together with them, right? It's like, because I personally know a lot of people that are in that world, and sometimes that's kind of the idea is, you know, we should be doing this and not that, but it's hard to get them to work together sometimes.
Yeah, again, you know, I think the healthcare landscape, if you look at it, it's a pretty large pendulum swing. If you think of it as a pendulum swing, you know, so you have, you know, maybe the medical providers on this side to this extreme, which are like, Western's the only way, you don't need anything alternative, you don't need lifestyle, you know, they're just very, and that's fine. And that works for some people, and that's great. But then to the other extreme, you have over here, these complementary or alternative practitioners that are so distrusting of the Western, where they will not do anything, they, you know, almost to their detriment. And so what we've done is we've narrowed the pendulum swing, and we're just in this sweet spot where we just find the people that realize that they both have their strengths and their weaknesses. They both actually complement each other very, very nicely. And how they complement each other is going to be very individualized to each person. So that's not for us to say. We're just here to provide you with the people that are within this sweet spot that are willing to be there for you when you need them.
I love it.
Yeah.
And I want to reach out to the audience right now, because I know this is resonating with some of you. I know some of you are climbing the walls right now going, yes, I got to talk to this person. But I want to know, okay, we want your vote, I guess, is, for lack of a better word. Go to our Facebook page, search Invisible Condition. Maybe that's where you're already watching the show. Thank you. because we're on YouTube, Facebook, and then E360 TV. Those are the three places you could be watching on whatever device you happen to be watching on today. But on Facebook, I found that's the easiest for me. Go and just comment yes. Just write yes in the comments, in the notes for the show, if you would be in support of something like that, a healthcare system that combines traditional plus alternative that are working together in that little sweet spot that Allison was talking about. So if you are like, yes, it's about time that somebody did, just acknowledge that and just write yes in there. And I want to see a whole bunch of yeses. I think we probably will. And because I think this is ripe for the picking, man. I think this has been a long time coming, and this is really cool. So
yeah. I'm very excited about it. The feedback has been overwhelmingly positive. And to answer your question, you were asking kind of in that pendulum swing, who do I get the most resistance from? Or, our directory, even though we are in our infancy, our directory is pretty much a 50-50 split at this point. I could not have more intentionally I just couldn't have more intentionally picked a better balance and diversity of the providers and practitioners that we have in there. It is pretty much a 50-50 split between the two sides. And we have over 16 different specialties or designations. So what I mean is, like, we have MDs, APRNs, pharmacists, herbalists, chiropractors, Reiki, healing touch, counselors, dentists. I mean, the list goes on and on. I just named a few, but so between those designations, we have, 16, I think, over that now designations. But then even beyond the designations, we have over 60 specialties. So, what that means is maybe you have, we have a few chiropractors, but even though they all have the same designation as chiropractor, they all offer a different type of chiropractic care and different services within their clinic. So that's where I'm saying that's over the 60 now, where even though, we're right at about 40 providers in our directory. So like I said, we're in our infancy, but it is just being so well received across all of them. And our list for contacts of who we need to add to our directory is just growing rapidly. And it's just going really, really well. And so I can't really say, I think we've been really lucky to get the providers and practitioners that really align with us, put in front of us. And so, it's been good. I haven't reached, again, I'm not going to the people that need to be, convinced or sold on something. So I don't see that too much.
Yeah, I get that. Yeah. And that's a really good place for you to be too, because I'm not that guy either. I'm not the hard sales guy either. If you like with our nonprofit, if you like what we're doing, join us. If you don't, there's 10 million other ones out there that you could, that you could join forces with and do some good. So I'm so not, so I'm so on board with that. So yeah. Well, we've got a couple minutes before we go to a commercial, but I put your QR code there. Or your website, and the QR code, everybody should scan that QR code, go to the website, check it out, read about what you guys are doing. There's tons of information on that website. When I went there, it was like, whoa, taking a drink from a fire hose. So
So for the really community, cool. for the providers and practitioners, I mean, all of the pages, you can visit all of them, and it'll kind of give you a better idea of how we operate and how we run and how we do what we do. And we can get more into that, the logistics of how it runs after the next break. But all of that information is on there, and how we can help the community, how we help providers and practitioners, and really how we advocate for everybody and are trying to inspire and empower everyone. So all of that is there. And if you have any questions, you can contact us, and we're happy to help you through it.
And if anybody has a question for you, is if I say, oh man, like I just wrote down two people that I thought, holy cow, maybe they should be working with Allison. Maybe they should be part of this community.
Yeah.
Within that sweet spot. If people have people that they know of that might be a good candidate for that, is that something you're looking for? Or
yeah.
Okay.
Yeah, absolutely. So right now, we're predominantly in Nebraska because that's where I started this thing. But we've had a lot of, I've talked to people in 12 different states now, and they all say, when's that coming to our state? So our goal is to go national. And we are currently the first and only multidimensional health association in the country, to my research and my findings. And there's a lot of clinics that maybe offer a multidimensional, just throughout the country. In every state, you can find a clinic that is maybe a multidimensional clinic, or maybe a convention, a health or medical convention that is more multidimensional. But there is no association where everybody from all over the country can come into this association and be found in one place. So
nice.
Yeah.
And that's what you're trying to grow, is that association that has all the resources that people can reach out anywhere in the country.
Right. Because that's one good thing that COVID did, was it really familiarized people with telehealth and made people more comfortable with that. So now it's not uncommon to be in Colorado or Nebraska and then maybe have a provider or practitioner in Florida or New York or wherever. So as long as, if there's licensing things, that requirements for whatever provider, as long as they cover that state, you can. And for practitioners, it's a whole different ball of wax. But again, we can get into that in a little bit. But, it's just not uncommon now where you could have a provider on the other side of the country. And, so we really think that it would be great if we can expand to that point of becoming national and help and connect people all over the country.
Well, with the track you're on, I have no doubt. So
thank you.
It's just a matter of time. And you can all help, by the way.
Yes.
Well, I asked the question because I kind of knew the answer, but I wanted to get it out there just in case you were curious.
Yes. Yeah. So if you know a provider or practitioner that would align with this, share our website with them, put them in contact with me. Again, on the website, there's a contact page, there's a phone number, there's an email. So just give them any of that information, and we would love to talk to them and grow this as much as we can. Or even if you're a business, we work with health related businesses and we want to support those businesses. And again, we can touch a little bit more on that as well. But investors, anybody, more be philanthropists because we're a nonprofit. So, but just a lot of opportunities to get involved and help support us.
Awesome. I love it. On that note, I think this is a good spot to take a break, but, so we're going to go to commercials just for a couple of minutes, but do not go anywhere. Stick around, because on the other side of the break, we're going to talk about some stories. We're gonna talk about some probably some ways that those worlds did combine and help people, and just we're gonna learn all kinds of good stuff about the organization. So nobody go anywhere. Stick around. We'll see you in just a couple of minutes.
In a world where office workers typically receive 130 daily emails and have an 8-second attention span, CoreCentrica, with her 4 decades of international marketing experience, has partnered with the Learning Code Institute and their 30 years of neuroscientific research. Together, we are crafting unique messaging strategies that resonate, connect, and ultimately convert our target audiences. CoreCentrica, where award-winning creativity and disruptive neuroscience come together. Scan this code now, or call and click, and let us show you how CoreCentrica's partnership with the Learning Code Institute is influencing how businesses connect with their audience, foster engagement, and achieve conversions.
I'm Sarah Stockham, and I'm host of Simply Sarah. Join me Thursdays at 3 p.m. Pacific on the Achieve TV network for the best energetic tools to elevate your amazing life right here on E360 TV.
Hey, everybody, just want to take a minute and talk about one of our amazing partners here at Invisible Condition, and it is called The Porch. And it is a coffee space in Portland, Oregon. And Brett and Molly run The Porch along with some amazing volunteers and staff. And this place, by the way, if you like coffee, I love this stuff. Good coffee. If you love really good coffee, you're going to love The Porch. It is a space where you can show up and be seen. The Porch is a nonprofit, actually, that seeks to provide training and opportunity to those who sometimes get overlooked in our community. You know who I'm talking about. Coffee can be a vessel that crosses all those bounds, and it enables us to, preserve dignity through generosity, hospitality, and most importantly, building relationships with your neighbors. And so you can be a part of that story wherever you are in the country. Go to the website, theporchcoffeepdx.com right here, or scan the QR code. I've made it super easy for you. All you got to do is scan the QR code and you will be at their website. You can access all their amazing coffees. There's a couple of them right here, actually, that I'm running a little low. Actually, I need to get some more. But it is amazing coffee, and they roast it, and or their roaster roasts it, and then they ship it as soon as they roast it. So it's phenomenal. So go to theporchcoffeepdx.com and check them out. You will not regret it, and they're amazing people, by the way, too. So we love Brett and Molly and want them to just thrive. So go check it out. All right. Okay, Allison. We are back, and I am excited because I actually have, everybody has stories, right? Everybody's like, oh yeah, you should have heard, the doctor said this, but the alternative person said this, or, I didn't know where to go. And okay, here's a question actually that just came to me is, do people, only because I've been in this situation, do people go to alternative, in your experience, do people go from medical to alternative only when they're like, they've tried everything else and they're like, oh my gosh, I got to find something that's going to help this. I'm desperate. What else is out there? Is that the main reason that they go alternative, or is it, what have you found?
I think, yeah, oftentimes that is the case, especially if they haven't been raised or exposed to that earlier in their life. Mm-hmm. And then, yeah, it oftentimes takes a desperate situation, and desperate times calls for desperate measures. And all of a sudden you're more open-minded and you're like, I'll try anything. I mean, that's the point I was at, right? So I do hear that a lot. For the people that have maybe their mom grew up trying to do more home remedies or natural things, then they're kind of already there and open to it. But yes, I've actually heard that a lot with even medical providers who at one point were very, very conventionally minded. And then, something personal happened to them or a family member of them. And because of that situation, all of a sudden they're like, okay, what else could we do? They just, I think when you or a loved one walk through a hard health issue, you really remove some judgments that you once maybe had, and you are just willing to try more or research more or look into more, and not just accept only something at face value as what's been presented to you up until that point. So yeah, I do see that a lot, but I also see a giant shift happening where more and more people are saying, what else? What else is there? The healthcare system is a very one size fits all type layout. And for so many people that works, and that's okay. And again, I'm not converting anybody or selling anybody. you really just have to meet people where they are. And so that's fine for the people that it's working for. But for the people that are saying, gosh, maybe I don't want to be on this medication, or I don't want to do this certain thing, or I would like to be proactive and preventative with my health and my healthcare, there's other options. And so it's about just cultivating that. And so I see it a lot, and I definitely see an increase in demand. And as much as I would like to claim that I'm the next Nostradamus and I'm predicting the future, I couldn't proclaim that. There is actually a lot of, yes, I did recognize the trend, but there is a lot of actually market research companies that have reviewed the CAM market, which is the complementary and alternative medicine market. And right now they're averaging that market is valued at $120 billion with a B. But by 2030, they're projecting that it'll be upwards of $695 billion. So, I mean, it is just going up. And I don't think that it's going to replace conventional medicine. I just think it's going to further integrate with it. So we really, really are at the forefront of this major shift and trend in healthcare.
I agree. And I think you're absolutely right. It's not going to replace it totally, because there's so many people that still need surgery, that still need traditional, like I'll give you the first story here. We'll just dive in here. And by the way, most of the guests that I have had on that have other invisible conditions, a lot of them dabble in both worlds. I mean, yes, they need medical care, but sometimes the medical care didn't quite do what they were hoping it would do, so they went elsewhere. The story I want to tell you is very much like that. In 2014, I had 2 brain surgeries back to back within 24 hours because of an infection that was going on in the cerebral spinal fluid. And thankfully it was in a pocket here in the abdomen, and it was just collecting because it couldn't reabsorb because of the bacterial infection. Wow. And they didn't want it to get to the brain. So I was in the hospital for 3 weeks. I had to have 2 back-to-back surgeries. It was a big deal. And it was a little rough, but we got through it. And we got out of the hospital and went home, and everything was cool. And then I started to develop migraines. And I was like, okay, this is not cool. I've had headaches, but these are different. And they were awful. And it got to the point that I was having literally 24/7, 24 hours a day, 7 days a week. I had migraines for over a year. It was awful. It was terrible. Yeah. I was starting to file for disability. I mean, it was like I'm on the couch for the rest of my life. If this is my new life, I'm just okay. Let's see what happens.
Wow.
But then I was like, let's go back to the neurosurgeon and see if maybe there's something that, what happened there, And I went back there a couple times, and what it came down to was he basically looked at me and said, well, I'm sorry, I guess you're just going to have to live with headaches, and that was literally what he told me. And great neurosurgeon. I have no ill will towards this guy. He was phenomenal. I love him. He's a great guy. He's in Denver. I would recommend him all day long, but it's just their scope of practice is so narrow that he couldn't recommend anything else. Just his hands were tied, and so we said, okay, well, I don't like it. I don't like that answer. So we're going to go somewhere, and that was kind of our beginning of our pursuing alternative things, and so we went and we started looking around, and we tried several things that didn't work, but we found a chiropractic neurologist, which turned out to be the only chiropractic neurologist in the state of Colorado. Thank you, Brad, because he brought me back from nonstop migraines to about cut it in half, cut the severity and frequency in half. And so I felt like I got a little bit of my life back. I was like, this is great, but maybe there's more. And then we found an alternative therapy, alternative right now, but called neurofeedback. That, within a month, completely got rid of the migraines. Wow. I'm sitting here before you because we didn't accept the answer of the neurosurgeon as the only alternative, and didn't say, okay, well, I guess I'm just going to be a couch potato for the rest of my life.
Right.
We said, we got to find something that'll work. And we did. And since then, those same modalities have not helped me quite as much with some of the symptoms I've had from the last 2 brain surgeries I've had in the last few years. But the human body is a fickle thing. It works sometimes, it doesn't work sometimes. I'm saying all this to say that you got to be open to all that because the human body changes, and because there can't just be one thing as the go-to. And so I am so thankful that we found those. With the last one I had in 2021, the most recent brain surgery, it was a totally different modality that helped. And so with some of the after effects. And so you just never know. You got to be open to explore and be, just say, what else is out there that could help me? And so, yeah, just wanted to throw that out there to kick it off. So.
No, I love that story. And I hear so many that are like that. And you had once told me, and I just loved this absolutely so much, that Western medicine saves your life, but complementary medicine gives you your life back. And I just love that because it is the epitome of how they can so well work together and complement each other. Yeah. And I just hear stories like that all the time, and they're amazing. They don't need to be in competition with one another. No. They really can just work so beautifully together.
I mean, the way I think about it is, and this is, I mean, it's, and a lot of the people that I've had on the show can relate to this. I don't know about the audience, but you've been with us for a year, and I so appreciate you watching all these stories because I know they're inspiring. But so many of these people have, they've been through so much, with surgeries and stuff. I mean, I've had about 15 surgeries over my lifetime, 7 brain surgeries, eye surgeries, wow. Regular surgeries that everybody has, but it's complicated by, the other the brain surgeries and the amount of scar tissue that leaves behind and all the things. And so for those of you that are out there that have had a lot of surgeries and that are looking for something alternative to relieve some of the after effects of all that, that is totally normal. You probably won't find a remedy for everything all in one place. So it's okay to explore.
Yeah. I love that you bring that up because I think it's one thing that I have seen in all the years that I've worked in healthcare. It's funny how patient oftentimes people are with Western medicine. If their provider suggests a medication and it doesn't work well or they have side effects, okay, give me another one. And then that one doesn't work so well, and they'll just keep trying it, and they'll just be very forgiving and just keep trying it. But if people try one natural modality, which there's so many different natural modalities or alternative complementary modalities, whatever you want to call it, if that one thing doesn't work, they're like, nah, I told you that natural stuff doesn't work. And it's like, well, wait a second. Like, how come you gave the other thing? Like all these chances. And I think it's just, again, people get to that point, but you and I could have the exact same diagnosis, and what works for me would not work for you, and vice versa. I mean, everybody is so uniquely individualized in their genetics and their epigenetics that sometimes it does take a little bit of time to find the right medication or the right herbal or naturopathic modality, or whether it's a physical modality like yoga or Pilates or physical therapy, whatever it is, chiropractic. Sometimes it takes a little bit of time to figure out how your puzzle pieces exactly fit together and what works best for yours. So yeah, I think it's very important to be patient with that process and allow yourself time to really explore what's out there on both sides. Yeah,
totally. Exactly. And I honestly, that chiropractic neurologist that I saw, like, he has almost become my primary care guy. He has had so many good resources that he has pointed me in the direction of, like, hey, try, oh, that's going on. Okay. Yeah. Oh, you know what? I know this guy. Try that. And so, I mean, that's the other cool thing is just because they're an alternative health doesn't mean that they don't, like, they network too.
Right.
They've got
Right.
a web of a huge network of people
Oh,
that
yeah.
they know that they can refer you to that
Mhm.
might be helpful. So dive into all of that. They all have so much knowledge.
Yeah, yeah, it's just so limited, right? I
Yeah,
mean, maybe if you find a medical provider that's open-minded, they might have like, a couple alternative people that they know. They obviously probably know a lot of conventional people that they know. Same
sure.
thing with the alternative people. They probably have a lot of, complementary and alternative people that they know, and maybe like one or two doctors that they kind of can trust and like. But with the association, we really bring that all together and we say we're vetting everybody that's joining is aligning with this mission and this vision. And so it really just expands and explodes that network of connections, from within the same city to outside cities to hopefully being, national. So it helps people in those situations. And I found myself needing this. It sounded like you needed it. When you're in the midst of a health issue, whatever it is, to whatever degree, and you're trying to mentally and physically digest whatever it is that you're having to deal with,
Hmm.
the last thing you really want to have to do is try to go research if you can find someone that you can trust. And then, do I waste my
Right.
money on it? And then what if you go to them and then they aren't respectable and they aren't really good at what they do? Now you've just wasted time and money and you have to start back over. So again, this is about, now you would have an association to go to that houses all of those people. So you can just go to a one-stop shop. You can find everybody that you know is going to be willing to play nice in the sandbox. They all align with this mission and this vision. And yeah, and it just saves people then that stress and that one extra step when they're trying to already handle so much mentally and physically.
It's already a vetted list.
Right.
It's like you don't have to look. You don't have to wonder. They're on the website, but really,
Yeah.
I
Yeah.
mean, you guys have done a lot of work to
Yes.
make sure that everybody is above board with all this.
Well, right. And that's just it. Because I have a medical billing company and because I've worked in, allopathic medicine for so long, I know what standard these medical providers are held to. And we all
Yeah,
know that these medical providers have to go to school for a very long time, pay a lot of money, do their boards, CEUs, licensure,
oh,
all
yeah.
these things. But then when it comes to the alternative world, it's a little bit more the wild, wild west, right? Like technically I could have just woke up one day and been like, I like plants. I think I'll call myself an herbalist. And there's no law against that. But I chose to I had the drive and I took the initiative to go to school. I went to school for 3 years to learn about herbalism, to
Yeah.
get the certification that I have. And I practice responsibly and professionally, and
Yeah.
I'm not practicing right now, but
No.
when I was, I don't have time now because I'm running a nonprofit, but it's about finding those people. So and I've designed those applications when we bring in these alternative practitioners and the medical providers. They fill out an application that holds them all to it holds the alternative practitioners to a very similar standard as their counterparts. And so
Yeah.
that makes everybody have a bit of peace of mind and feel like they can really trust what's happening. Because again, that's, I think, one of the largest feedbacks that I got, or hesitations that I got from medical
Yeah.
providers, is they're like, how can I trust this person? Did they even
Right.
go to school? Did they just read an article one day and now they think they know it all? So
Yeah.
that application and that vetting process really gives them peace of mind. And so, yeah, it really allows them to be more willing to work with those alternative practitioners, and even amongst the alternative practitioners too, even just amongst that side as well.
And so, so when you get these applications, and I don't know why I'm fascinated by this. When you get these applications from these, potential people that want to work with your organization, do you do the vetting, or is it like, does your board have something do you have who reads through this and says, okay, these guys are legit, add them to the list,
Yeah. Yeah. So right now, yes, it is me. But if I ever get an application, which I have, where I'm not really sure they meet the requirements, then yes, we do have a board. And then that application gets presented to the board and the board takes a vote on whether they feel that that person is appropriate or at the point that they could join the association. So yes, it goes through me. Some people, have a very long laundry list of all these educations and, things that they've done. And other people are just getting into it. So there's a lot of varying degrees. But again, we kind of have these rubrics and things that we follow that set that standard. So if there's ever someone that isn't really, meeting those rubric check marks per se, or we're not really sure, then yes, it goes to the board and there is a vote. But so these providers practitioners, they apply to join, they get 9 different benefits for being a part of our association. And those I'm sure will continue to grow. The benefits will continue to grow. But then once they're a part of the association, once they're approved, they get put into our exclusive directory. Our directory is secure behind a passcode. And I did that for a couple different reasons. First, because there's so many lists on the internet that are data mined, where the internet has just gone and pulled the names and plopped them together. And you really don't know where it pulled it from. And it's just kind of a mishmash. And I did not want our list to feel like that. Our list is extremely intentional. These providers and practitioners have either found us and resonate with this, or we've recruited them and said, hey, your name was given to us and this sounds like it might align with you. And it does. And so they are passionate about it and they join and they apply and they pay an annual due. And so that's why they're in there. Secondly, I also put it behind a passcode because I had met with a immunologist when this was just a seedling of an idea. And I was like, hey, I want to shoot something out to you. Give me what your feedback is. And he, very sweet, very intelligent man. And he said, I think it's needed. And I think, what you're onto is a very powerful thing. He goes, but I'll share a story with you. He said, for years, I have had back pain. I was born with a genetic back disorder. And for years, my spouse, who is a physician, told me to get back surgery. My peers who are physicians told me, why don't you just get back surgery? Just get back surgery already. And he's like, I don't want back surgery. That is a major surgery. Yeah. And so he said, with some research, I found some different alternative things that worked for me. And now my back doesn't hurt anymore. And so he goes, and even though I did that, my wife and my colleagues think I'm nuts. So he goes, I think you have your work cut out for you. And I said, I said, thank you for your candor. I appreciate that. But I said, with all due respect, I'm not going to people like your wife and your colleagues. I'm going to people like you who realized there might be another way. There might even, and will that other way work for him forever? Maybe, maybe not, but it's working right now. He's not needing back surgery right now. And so for providers that are maybe in precarious situations where they're surrounded by other providers that maybe aren't quite there yet, we didn't want them to not join because they might be judged by their peers. Like, hey, I saw you're on a list with a bunch of herbalists. What are you doing? So now it allows them to join, but still have a little bit of that privacy and exclusivity while this is still, at the forefront of this trend. I think in time, this is going to be so widely accepted and known that we won't even need to have that. But for right now, when we're still at the forefront, I do run into providers that are in that position where they're like, gosh, I really do align with this and I really want to be a part of this and I want to meet these alternative practitioners. But they're like, oh, what would my peers say? And so a lot of them see quality and benefit to that. But
100%. I think that's a awesome thing. I mean, and I no matter how big you guys get and no matter how widespread this becomes, I think that the protection and the anonymity of that is pretty valuable. I mean, because there's always going to be somebody that's going to say, no matter how big you get, there's still going to be providers that don't want to be publicly out there that they're on the list. So
I mean, you could be the sweetest peach in the field and there's still going to be someone that hates peaches, right? So so we know that, and that's fine. But it just, for right now, it kind of offers again a little bit of that exclusivity and privacy. I don't know if you want to jump into this now or if we got to go to another break, but I was just going to tell about how we can help the community and what some of the other things are that we're working on for the community.
That's a perfect place. Thank you. Let's do a break real quick, and then we'll come back to that, and we'll dive right into that as soon as we get back.
Awesome.
Yeah. And then that'll be a perfect segue there. So yeah. All right, everybody, stick around. We'll be right back.
In a world where
Does your to-do list have you feeling stressed? Does your list include tasks like responding to email and phone calls, collecting forms and paperwork, and sending quotes and invoices? Have you been neglecting posting updates to your social media accounts, email newsletters, or content on your website? Maybe you need help to get digitally organized. I'm Selena, one of the owners at Office Mercenary, and we're a US-based virtual assistant agency. We can take care of all of these tasks and more so you can get back to focusing on the things you love about your business. Our team is happy to work with you and your individual needs. So schedule a call with us, bring your to-do list, and stop doing the tedious tasks.
Everybody, we are in our last segment here, and it's kind of unbelievable that we're here, but we're here. Time flies when you're having fun, and so and I know that there was a couple things that we brought up before the end of that last segment, but I gotta ask this question. Mm-hmm. I ask everybody this question because I always love hearing the answer, and everybody has a different answer, but they're all awesome. And so, especially with what you're doing, I mean, with all the things you're doing, and you know, on the hard days, maybe if you know, there's days that they're not all easy, right? As an entrepreneur, somebody running a nonprofit and trying to get this ball rolling. On those hard days, how do you still maintain hope?
Maintain hope?
Yes.
Gosh. I know that everything that we deal with in life is very transient. So nothing is permanent in life. And so everything is cyclical. So whether you apply it to nature, the waves crash in and fall out, the leaves and trees, you know, bud and come to life, and then they die off. Everything is on a cycle. So sometimes we're showered with great luck, and other times we're kind of getting a little rut and we have some bad luck. But you just have to know that we are not special enough to just ever stay stagnant. Nothing is permanent. Everything is constantly moving. So I think when you have that awareness and you choose to focus on that, like, okay, if I'm going through a rough time right now, and while you're in it, it feels like it's never going to end. You're like, is this forever? It feels like that. But you have to remember, like, if you reflect back on everything in your life, you could probably easily find, like, this was a really great time. This was a hard time. This is a really great time. This is a hard time. There's so much of that ebb and flow. And that is the one thing that is, well, that and taxes, right? That are constant in life. There's always going to be taxes and there's always going to be ebb and flow. So I think if you just have that awareness and know that if you're in one of those points where you're having a little bit rougher time of things, just constantly focusing on, this isn't forever. There is going to be a better time. And I think I also, when I have entrepreneurial struggles or hardships where, you know, you don't get the deal or something doesn't pan out the way you want to, I also like to choose the perspective of, it didn't happen for a reason, and it's because there's something better coming that's more applicable and more appropriate for my needs and the greater good of this association or whatever business it is I'm working on. So I really try to keep those things at the forefront. I'm still a human, right? So it still sucks when you have to go through the yucky parts and the icky parts that are uncomfortable. But yeah, I think if you can choose to focus your attention on the lighter things, or how the lighter things will come back,
Sure.
as they always do. And then just really be grateful and appreciative when you're in that lighter time, because you have to remember that probably won't last forever either, unfortunately. So yeah, it's just, just really, choosing where to put your attention.
Awesome. That's perfect. And, you know, we're about out of time. We've got about 2 minutes, 3 minutes left, maybe. I know I know. Maybe you got to come back.
Yeah.
Maybe we got to, you know, but first we've had this QR code throughout the show on there so that people can get a hold of you easily.
Mm-hmm.
What is, if you can do it in like 2 or 3 minutes, is there, what's coming? Is there something big that you like, future initiatives or anything that you...
Yeah. So the ways that we help the community and stuff, we have clinical liaisons. They don't diagnose, prescribe, or persuade you, but they just help you to better understand maybe how these different providers or practitioners could help you. We try to help guide you into which ones you could potentially reach out to and explore. We are hoping this year to roll out a grant program. The grant program would help people be able to apply for us to help them pay for the non-insurance covered modalities. Or yes, that's a huge one we're working on.
Awesome.
Securing those philanthropic funds. This year, we're also hosting our very first gala. That's going to be on Thursday, October 24th. So we're just getting ready to post that event page on our website. It's not there yet. I don't know if it'll be up quite yet when this airs or not, but hopefully within the next few weeks, that'll be up. Hopefully before the end of May, that event page will be up so you could learn more about our gala, or if you would like to be a sponsor of the gala. There's a lot of different ways to help support us, but yeah, just be a connector. If you know those names that you could, you know, a provider, a practitioner, a business owner, an investor, something like that, philanthropist, put them in contact with us. If you would love to just be a supporter and just share and follow on some of our social media posts, that would be amazing. If you have the funds and you would like to support us, donations are great. You can do those right through the website. So yeah, there's so many different ways and that you can help us and get involved. And we're just here to help you as well too. So we're trying to expand as quickly as possible and reach and help as many people as possible. But yeah.
That's awesome. I love the gala is going to be so cool. That's the big one that I'm like, yeah, let's get that one out there. So yeah, maybe that's the next show. Maybe we do another one in a little bit and really start talking about that. And
would love to.
Yeah, let's talk about that. That would be really cool. So I want that to be a huge success for you. So that would be great. So
yeah.
Well, yeah, I think unfortunately we're out of time, but Allison, thank you so much for being here. This is awesome. I'm so glad that we got to do this and that we connected and were able to pull this off. And I definitely think we need to have you back in a little while. So this is not the last we'll see of you, but thank you so much for being here.
Thank you so much for the opportunity and for having me and allowing me the opportunity to speak on it.
Absolutely. Thank you. All right, everybody. Man, that was cool. Very cool. I'm sorry. My head is kind of exploding. I mean, every time I talk to Allison about this, it's like, it's like more stuff that my brain can handle. So we're going to have to do another show just to fit it all in. But thank you so much for being here, everybody. And if you have been watching for a while, thank you. If you're new, thank you. We appreciate everybody watching. We're so thankful that you're here and that you've been with us all this time. And if you have a favorite episode, share it out. If this is your new favorite episode, share it out. Go to our Facebook page, go to our YouTube channel, subscribe, like, share, all the things. Let's get the word out about some of this stuff, man. This is why we're doing this show, is to spread awareness of all the conditions that are going on that people can't see and what people are doing about it. So thank you, Allison. Thank you to all of you watching, and join us for our next show on Tuesday, May 28th. Till then, have an amazing day. We'll see you next time.